Welcome back, everybody, to Dan Williams Survive Outdoors. Today we are focusing on the poison ivy plant. This is a very large vine here going up this dead walnut tree, and it looks even like we have looks like a pileated woodpecker's been visiting this tree. And you can even see in some areas where the berries are starting on this very large vine. These are really large leaves on this vine. We're going to, here's basically my hand, and some of these leaves are clearly the size of my palm. So this is a really massive vine. Well, I want to go over here to this other tree and show you. Often this gets confused. I'm not really sure why people confuse it, but they do. This is another vine that is going up this dead tree is here, and this is also a mature walnut. But people can sometimes confuse this five-leaf vine, Virginia creeper. And the true Virginia creeper is poisonous. There's actually been one child a few years ago pass away from eating the berries. This, as I touch it, is a false Virginia creeper. The Virginia creeper has a hairy stem, and the false Virginia creeper has a smooth skin. The skin under the leaves as well as the stem are going to be smooth on a false. The true Virginia creeper will have hairy areas underneath the skin there and the stem. Poison ivy is in the genus of Toxicodendron, and that's poison ivy, the poison oak, poison sumac. This is an area of controversy, is the geography of where these plants are, and I'm sure there's going to be people disagreeing, but I have to give you the truth as it's written and as I see it with my experience. So poison ivy, for the most part, is east of the Rockies. Poison oak, for the most part, is west of the Rockies, and poison sumac is mostly in the southeast portion of the United States. Now, according to the Chicago Botanical Society, as well as Illinois Department of Natural Resources, there is a spot of poison sumac in the northeast corner of Illinois, and possibly some poison oak in pockets in the Shawnee National Forest in extreme southern Illinois. Poison oak and poison sumac are more of a bush. So I'm sure there's going to be individuals that are, oh no, I ran into poison oak and I know it was. Well, back in the day when we had Survive Outdoors in the beginning, there was actually, I was offering a reward, monetary reward, for finding poison oak in Illinois. Send me a photograph. I didn't have any takers. So the poison ivy plant has different variations of, like many plants. The poison ivy leaf can be shiny. It can be dull. It can have serrated, jagged edges on the leaf, and it can have straight edges on the leaf. It does have berries. The leaves will turn red in the fall. And if you noticed in the very beginning of the video, that vine did have berries beginning here on the spring. So the resin or the sap is urushiol, and that is what causes this massive allergic reaction that individuals get, and they present to me in the clinic. The rash starts out with redness. It can be streaking, and then it can expand farther than that. It will weep, and it can be very extensive and extremely itchy, clearly. So one of the questions I get is, how do I know when I'm going to get this rash after I've been exposed to it? So, and the car's gone. So how you're going to know is that, just like I talked about in the past with wasps and bees, if you've been bitten or stung and then you get bit and stung again in a few months, you can have a more severe reaction, and it can be quicker. Very similar to the allergic and immunoresponse with poison ivy. If you've had poison ivy, poison oak, poison sumac, and you've already been sensitized to it, your symptoms will occur in about 24 to 48 hours. If it is your first interaction with that plant, you may not get symptoms. They may not start for 10 to 14 days. If you do nothing at all and you can tolerate it and use over-the-counter meds, it will go away in about 2 to 3 weeks. The other question I get is, can I transfer this to my kids, my spouse, people at home after I have it? Yes and no. If you get the rash, if you're around poison ivy and you don't take a shower right away, in the first few hours, you still have that resin, that urushiol on your skin and clothes. Go in, give someone a hug, you're playing with your kids, you can give that oil or resin to them that day. Unequivocally, you can. If you have showered and you've washed it off, no, you're not. And the fluid that comes from the lesions, that is not contagious. You will not give that to a friend, a loved one at all. It's just not going to happen. So now we're going to get into the over-the-counter treatment and prescription treatment. Before I jump into over-the-counter treatment, prescription treatment, and then prevention, I'm going to talk briefly about the studies that have come out in the last 5 to 10 years in terms of CO2 in the atmosphere. Stanford, Duke University, University of Georgia. These are extensive studies done by people that have passion in botany, passion in these plants. At Duke, they did a study where they actually had a few acres and they literally pumped CO2 into the area and measured the growth over a couple years of these plants. The leaves are clearly getting bigger, and these plants are developing more and more urushiol. So we're getting more and more exposures and worse exposures. And this is measurable. This is not some liberal conspiracy. This is measurable, objective data that the plants are getting bigger. So it's important to note that and be aware. They also talk about there's more frequency of it. Well, there's more people getting in the outdoors also. So I don't know if you can draw a direct cause and effect of that. But you can definitely measure if the experience that the person is having is worse, and you can definitely measure if the plant's getting bigger. So, treatment. So, over-the-counter treatment. What are you going to do? I mean, everybody's trying to make money, and there's tons of products out there on the market. I'm going to run through quite a few of them. Iva Rest. This is a combination antihistamine and analgesic. It has diphenhydramine in it. It has benzyl alcohol and calamine. Remember when you were little, when you ran into, you got some poison ivy, your mom or dad would treat that with the pink stuff on a cotton ball and your legs, and you'd be pink all over. You'd look like a bottle of Pepto-Bismol. So this definitely helps with the itching, and it's not bad. It's not a bad product. It's not really that expensive. I think it's like $5 for this box. The other thing you can use is cortisone. They make a hydrocortisone. It's 0.1%. Definitely helps with the itching if you catch it early, and not a bad product whatsoever to use. I actually advise patients to use this if they have a very mild case. That way I don't have to prescribe them a prescription steroid. This is a very popular one. It is Tecnu, T-E-C-N-U. This is, you want to wet the area with cool water first. You're going to apply this to your skin, rub it in for about 10 to 15 seconds, and then you can rinse it off and pat it dry. And this definitely helps with the itching also. Pretty good product. Calamine. What would a poison ivy discussion be without calamine? They got smart. They got calamine spray. And what's really nice, with calamine lotion, it's very watery. You would put it on and it would run down your arm. You'd have all these streaks and it was just a mess. They put it in a spray, and it's really effective and beneficial to decrease the itching. You can also do oatmeal baths. It's not really a bath. You could take a bath with, like, it's 1 cup of the Vino makes it, a Vino oatmeal. They make a really good product. You put 1 cup of oatmeal in the bathtub, you sit and soak in it. Non-toxic, definitely helps with the itching. One of the, it's expensive, one of the over-counter ones that's really been popular the last few years is Zanfel, Z-A-N-F-E-L. And this is supposed to bind with the urushiol and literally remove the poison ivy product from, or the poison ivy sap from your skin, and it does help. It's expensive. It's about $40 to $45 for this box. Now, what I've read is in the last year to 2 years, they took one of the ingredients out because they were having some side effects. And it's not as effective, and that's what some of the reports are saying. I can't give you a yes or no on that. You might want to try it and see. So there's mild, moderate, and severe responses. Mild responses to poison ivy, you can definitely use the over-the-counter. It'll work fine. If you use nothing at all and it doesn't get extreme, it'll go away in about 2 to 3 weeks. But it's very uncomfortable. So, mild case, you have it on 1 extremity, maybe 2 extremities. It's not extensive. You use the over-the-counter meds, take some Benadryl over-the-counter, some tablets for itching, and you get better. Cool showers, not hot showers, by the way. That'll make it worse. So moderate is you have it on more than 2 extremities. It's on your torso. It's pretty extensive. The itching is driving you crazy. You're getting a lot of weeping. And you just can't tolerate it. You can't hardly go to work because you're scratching. In those situations, I would advise you to come into urgent care or to the emergency room and get checked out. And in those situations, we'll prescribe prednisone, a stronger steroid cream, and you'll get better very quickly. Now, for all my providers out there, what I do is I do a 3-week taper course. The conversion is 1 milligram per kilo. I do 60 milligrams a day for 5 days, then 40 milligrams a day for 5, and 20 milligrams a day for 5, with some Benadryl, and with like a clobetasol, a higher potency steroid cream. Medrol dose pack in moderate cases to severe does not work. It does not work at all hard. If you have to do a longer course of prednisone. Word of caution on prednisone if you're taking it. Be aware if you have glaucoma, cataracts, diabetes, it can definitely affect those. So you want to have a word of caution about that. The other thing that I want to mention with prednisone is about 15 to 20% of the population can get moody, can get agitated, and increased appetite, and have insomnia. When I've taken prednisone, I get insomnia, and you just don't want to be around me. So that's pretty well the standard of care. In severe cases, I've only had one in about the last 30 years where they had to be admitted and they got IV hydrocortisone, and that was from head to toe, in the eyes, everywhere. And yes, you can get it in your lungs if you burn it and you breathe it in. So you get like a pneumonitis and inflammation of the lungs. So that's important to note also. If you're burning brush from a fence row, whatever, stay away, watch the wind direction. Prevention. Plastic gloves, like surgical gloves, does not work. The urushiol will penetrate plastic gloves. You need leather gloves, long sleeves, long pants, no shorts. Those help a lot. You need to wash your clothes very quickly. You need to do at least 1 wash and rinse in hot water, maybe 2. It is true that the urushiol resin can stay on clothes, tools, boots, from 2 to 5 years. 2 to 5 years. I have deer hunters that come in and see me 6 months later. They haven't been around any poison ivy. And I said, did you move your hunting boots? Have you moved your clothes recently? Did you rearrange your closet, your bow, anything? And sure enough, they did. And that's most likely where they got it. For our instruments and like shovels and rakes, gasoline works really well. If you can't wash it off with soap and water, and I mean scrub it. Take soap and water and just wash your arms and hands. not going to cut it. You need to take a washcloth and wash it really, really good. That, if you do that soon after, you shouldn't have an occurrence whatsoever of the poison ivy. Alcohol, you can use rubbing alcohol on your arms, and that will definitely help it in terms of not getting the rash if you do that soon after. Don't use alcohol in children. You can get an absorption toxicity with that, so that's important to note. So, yes, it can be treated. Yes, you can prevent it with some good judgment. You need to learn how to identify it. There's some great apps out there that you can use where you can take pictures of your plant, and they're pretty accurate. If you have any questions, leave them down below. I would love to hear them. You got some suggestions. Maybe something's worked really well for you. I would love to hear those also. If you like the video, give me a thumbs up. Please subscribe. And see you next time. Keep your eyes on the horizon, your face to the wind. See you guys.